High blood pressure, the silent killer you can't afford to ignore. High blood pressure is often called the silent killer, and for very good reasons. It doesn't cause pain or obvious symptoms. So many people don't realize they have it until a serious event, like a stroke or heart attack, suddenly happens. For many seniors, high blood pressure quietly builds over time, day by day, year by year, until it strikes without warning. What's even more alarming is how easy it is to overlook the everyday habits that contribute to it. Habits that seem small or harmless, but actually play a huge role in raising blood pressure. Every day, the simple choices you make, what you eat, how much you move, and how you handle stress impact your blood pressure far more than you might realize. Many people over 50 believe they're doing everything right, taking their medications, going to regular checkups, trying to stay active. Yet hidden within their routines are subtle mistakes that steadily increase blood pressure and strain the heart, brain, and entire circulatory system. If left uncorrected, these habits continue silently damaging your health. That's why this message is so important. We're not here to overwhelm you with medical jargon or criticize you for mistakes. Instead, our goal is to bring clarity, to highlight the most common errors in managing blood pressure and offer simple, practical changes you can make. Whether you've been managing hypertension for years or have just started paying attention to your numbers, this guide is designed to help you regain control of your health in a way that's smart, doable, and encouraging. Managing blood pressure is about more than just numbers on a screen. It's about staying active, thinking clearly, sleeping well, and living life with confidence. And that all begins with knowing what to avoid and what to embrace. So, let's start with the first mistake, the foundation for building a stronger, steadier heart. Mistake 1: skipping or taking medications incorrectly. Managing high blood pressure usually starts with prescribed medication. These medicines are among the most effective tools we have for controlling blood pressure, but only if you take them correctly and consistently. One of the most dangerous and common mistakes seniors make is skipping doses, taking pills at the wrong times, or stopping medications altogether without consulting their doctor. There are many reasons this happens. Some forget others feel fine and assume they no longer need the medication. Some worry about side effects or dislike feeling dependent on pills. Others try to save money by cutting pills in half or taking them every other day. While these decisions may feel reasonable in the moment, they can cause dangerous blood pressure fluctuations that strain the heart and increase the risk of stroke, kidney damage, or heart failure. Blood pressure medications are carefully tailored to your body. They don't just lower a number, they protect your cardiovascular system. When doses are missed, or irregular blood pressure can spike, silently damaging arteries and increasing pressure on vital organs without any warning signs. What's tricky is that blood pressure medications often don't create a noticeable feel-good effect like some other drugs do. You may not feel better immediately after taking them, which can lead to underestimating their importance. But behind the scenes, these medicines are doing crucial work, easing the pressure on your heart, improving circulation, and reducing the risk of life-altering complications. The good news? This mistake is completely preventable. Make taking your medication a non-negotiable part of your daily routine. Take your pills at the same time every day, using reminders like pill boxes, alarms, or daily checklists. If you miss a dose, don't double up. Call your doctor for guidance. And if you experience side effects, speak up. Often, doctors can adjust the dosage or prescribe alternatives to help you feel better without compromising your heart health. Never stop your blood pressure medication just because your readings look normal. That's usually a sign the medication is working, not a reason to quit. Always consult your doctor before making any changes. Even small adjustments can affect how well the medicine works. If cost is a concern, talk to your healthcare provider about generics discounts or assistance programs. Managing blood pressure is a long-term commitment, but one that rewards you with more energy, stability, and peace of mind. One pill, one day, one decision at a time. Your heart is counting on you. Mistake 2. Consuming hidden sodium without realizing it. You may not be shaking salt onto every meal, but sodium is hiding in many of the foods you eat daily. This is one of the most common and overlooked mistakes in blood pressure management. Sodium causes the body to retain water, increasing blood volume and pressure on artery walls. Over time, this extra pressure damages the heart and blood vessels, raising the risk of stroke, heart attack, kidney damage, and other serious issues. Because these effects are silent, it's easy to underestimate how much sodium sneaks into your diet. Packaged foods, canned soups, sauces, frozen dinners, breads, deli meats, and even products labeled as low-fat or heart-healthy often contain high sodium levels to enhance flavor and preserve shelf life. When these become staples, because they're convenient or familiar, sodium adds up quickly. For seniors, this problem is even more critical. As kidneys become less efficient with age and the body becomes more sensitive to sodium, even moderate intake can cause significant blood pressure increases. Sodium retention also worsens swelling and conditions like congestive heart failure. The first step is awareness. Start reading food labels carefully, not just for calories or fat, but for sodium content. A single serving of canned soup can have more than half your daily recommended sodium. Choose products labeled low sodium, less than 140 mmol per serving, or no added salt when possible. Rinse canned beans and vegetables to remove excess sodium and opt for fresh or plain frozen foods without sauces. Cook more meals at home, where you control the ingredients and use herb spices, lemon vinegar, garlic, or pepper to add flavor instead of salt. It may take a few weeks for your taste buds to adjust, but you'll start to appreciate the natural flavors of food and find overly salty dishes unpleasant. Cutting back on sodium isn't about sacrificing enjoyment. It's about supporting your heart, protecting your health, and living with more clarity, energy, and balance. Mistake 3. Not monitoring blood pressure regularly. Blood pressure is something you can't feel until it's dangerously high or causes a serious event, which makes it deceptively risky. Many seniors only check their blood pressure during doctor visits and assume that's enough. However, blood pressure fluctuates throughout the day based on stress, sleep, diet, and activity. A single reading at the clinic doesn't tell the whole story. Sometimes, readings can be artificially high due to anxiety, or falsely low if you're relaxed. Home monitoring gives you a fuller picture of your blood pressure trends and can save your life by detecting dangerous changes early. Without regular checks, you miss clues about medication, effectiveness, new stressors, or dietary changes that might be affecting your health. Home blood pressure monitors are easy to use, affordable, and often store previous readings. The key is consistency. Pick a set time, like morning or evening, rest calmly for 5 minutes. Keep your arms supported at heart level, feet flat on the floor, and avoid talking during measurement. Keep a log paper or app and share it with your doctor. This makes visits more productive and allows for smarter adjustments before serious problems arise. Don't avoid monitoring because you're scared of bad news. Ignoring it only lets problems grow unchecked. Mistake 4. Letting stress go unmanaged. Stress isn't just something you feel mentally, it's a physical burden your body carries. While diet and exercise get a lot of attention, chronic stress is one of the most underestimated causes of high blood pressure. Stress triggers your body's fight or flight response, releasing hormones like adrenaline and cortisol that constrict blood vessels and raise heart rate temporarily. If stress is constant rather than occasional, your arteries stay tightened, your heart works overtime, and this chronic pressure can cause lasting damage that medication alone may not fix. Stress often hides in subtle ways. Tense shoulders, tight chest, restless sleep, or quiet feelings of overwhelm. Many seniors grew up with messages to tough it out and may downplay or ignore these signs. Ignoring stress doesn't make it disappear. Instead, it drains your energy, shortens your patience, and silently raises your blood pressure. The good news: managing stress doesn't require drastic changes or expensive treatments. Simple daily habits like deep breathing, gentle movement, walking, yoga, stretching, time in nature, listening to music, gratitude journaling, or talking with a friend can calm your nervous system. Building a routine of stress care, not just reacting when overwhelmed, but proactively making space to unwind, is essential. Think of it like brushing your teeth. Prevention, not just treatment. Be kind to yourself as you start this journey. Each breath, each walk, each quiet moment contributes to a calmer mind, lower blood pressure, better sleep, and greater peace. Mistake 5. Physical inactivity and sitting too much. Not moving enough is one of the most overlooked factors raising blood pressure in seniors. Rest is important, but prolonged sitting and lack of physical activity cause your heart to work harder and your blood vessels to stiffen. Exercise strengthens your heart so it pumps blood more efficiently, reduces inflammation, supports weight control, and lowers stress, all crucial for cardiovascular health. Many seniors hesitate to exercise due to joint pain fatigue or fear of falling. But physical activity doesn't have to be intense to be effective. Light, consistent movement, such as daily walks, stretching, or gentle chair exercises, helps get blood flowing and lowers blood pressure. Try to stand or move briefly every 30 to 60 minutes if you spend long periods sitting. March in place. Walk to the kitchen. Do shoulder rolls. These small actions add up. Find activities you enjoy, like dancing, gardening, or water aerobics to help you stay motivated. Consult your doctor or physical therapist for safe options based on your health. Remember, exercise isn't about becoming an athlete. It's about maintaining independence, balance, and heart health. Mistake 6. Overusing caffeine or alcohol. Many enjoy a morning coffee or a glass of wine, and in moderation, these can be comforting. But for seniors managing high blood pressure, excessive caffeine or alcohol can quietly worsen their condition. Caffeine found in coffee, tea, soda, energy drinks, and chocolate stimulates the heart and narrows blood vessels, temporarily raising blood pressure. Effects vary individually. Some tolerate caffeine well. Others experience prolonged spikes. Monitor how your body reacts after caffeine: headaches, jitters, racing heart, and consider cutting back or switching to decaf if needed. Alcohol can relax you in small amounts, but raises blood pressure, interferes with medications, dehydrates, disrupts sleep, causes weight gain, and increases stress when consumed excessively. Seniors metabolize alcohol more slowly, amplifying these effects. Limit to 1 drink per day or less, and avoid mixing alcohol with blood pressure medicines to reduce risks like dizziness or liver strain. Cutting back even slightly can lower blood pressure, improve sleep, and stabilize energy. Try heart-friendly alternatives like herbal teas, warm lemon water, or fruit-infused sparkling water for a soothing ritual without the downsides. Mistake 7. Not communicating openly with healthcare providers. Finally, one of the most avoidable but common mistakes is failing to maintain honest, regular communication with your healthcare team. Blood pressure fluctuates with lifestyle, emotions, medications, and seasons. It's not a set it and forget it condition. Without full information, your doctor can only make decisions with half the picture, which can delay needed changes or miss warning signs. Don't hesitate to discuss symptoms, side effects, new supplements, lifestyle changes, or emotional concerns like stress or loneliness. Your doctor is your partner, not a judge, and can adjust treatments or connect you with support services. Bring your blood pressure log to appointments or share it via patient portals. If travel is difficult, ask about telehealth options for easier access. Good communication doesn't require long talks, just honesty and openness. Your health is a team effort, and staying connected is one of the smartest things you can do to protect your heart and future. Conclusion: managing blood pressure is a journey of small, smart habits. Managing high blood pressure doesn't require a perfect lifestyle, endless restrictions, or constant worry. It requires awareness, knowing which daily habits matter, listening to your body's signals, and making empowered choices one step at a time. Blood pressure is more than a number. It reflects how your body lives, breathes, rests, moves, and responds to life. Now that you've learned the 7 most common mistakes and how to avoid them, from medication, adherence to sodium intake, physical activity, stress management, communication, and mindful use of caffeine and alcohol, remember, you don't have to change everything at once. Start with one area. Maybe checking your blood pressure regularly, swapping a salty snack for a fresh one, or setting reminders for medication. Every small step you take builds a healthier heart, steadier life, and stronger you. At NutriHub Bliss, we believe good health is built one habit at a time. Support each other, stay informed, and take control, one heartbeat at a time.